Welcome to Morning Report.
I wonder what the case is going to be today. $5 says it's going to be something infectious.
Deal, but I bet you there's a psych component somewhere. Let's talk about our census. We have 2 patients on the ward. One we are presenting, and the other is our chronic heme-onker that has been living in the hospital for the past 5 months. There are also 2 surgical cases on the ward that we are consulting on because the surgeons don't know how to dose Tylenol. The NICU has 14 babies, of which 13 are feeder growers, and 1 baby that was reintubated with a PDA, status post neck, and 5 surgeries. The PICU has 0 patients, and the nurses are requesting that no patients be admitted. Announcements. Rototech next Thursday, we are going to drink our faces off. Friday is intern switch day, but it doesn't matter because they don't work anyways. This week's continuity module is Bieber Fever in adolescent females. Admin announcements. Please turn in your dimmer's eye. It was due 5 days ago, and nobody reads the emails. We discovered a glitch in Alta. It was due to a system overload from too many reply all emails. For those of you who keep replying all, please stop it. It is jamming up the system. They are also discussing a new 7th pillar to our hospital. For those of you who are interested, Tim Flynn, please contact Dr. So-and-so. We now have a case from the ward.
Good morning, I'm Dr. Intern. I've been here for 10 months, but I still feel the need to introduce myself every single time. Happy Tuesday. Our case is a 15-year-old female, previously healthy, who presented to the ER for joint pain. 2 days prior to presentation, she developed right knee pain, initially described as an ache, 4 out of 10 without radiation. She denied any trauma, is a competitive ping pong player, but is currently off season and denied any tweaking of her knee while aggressively hitting the ball. She also denies the ping pong ball hitting her knee. The knee initially was not swollen.
Excuse me, intern. Did you by chance ask if the patient performed any spin moves during ping pong? I'm not quite familiar with the rules these days.
Only twice, sir, and she got a point both times.
Roger that. Aerosol.
What did her knee look like?
Well, I was just about to describe that before your interjection. Or if they would only stop interrupting me and let me finish the presentation. However, the pain had spread to her other knee on the day of presentation, so that is why she presented to the ER. She denied any recent illnesses, sore throat, nausea, vomiting, abdominal pain. She did admit to some chills on the morning of presentation, but they resolved. She denies any recent hiking or outdoors activity, does not recall any bug bites, and 2 weeks ago she was at a ping pong tournament and was hit by a ping pong ball on her left thigh that left a red circular mark that resolved in about a week.
Did she have a rash?
Sir, other than the mark I just described, she did not recall any type of rash. Her past medical history is boring, and her surgery is just a tonsillectomy at age 12. Her head's exam, she lives at home with her mom, her dad, her younger brother Joe, his twin sister Maggie, 2 dogs, a Siamese cat, a turtle, and a grandma. She gets along well with her parents and strives to please. She's in the 10th grade. She skipped kindergarten due to intellectual proficiency. She wants to become a scuba diving archaeologist when she grows up. She's a competitive ping pong player for activities, a swim team manager, and the class president. For drug exposure, she does admit to trying 1 magic brownie and felt so guilty that she confessed it to her parents. Otherwise, she's interested in boys, not dating anyone currently. She denies suicidal ideation, and for safety, she once didn't wear an eye guard and got hit in the eye during ping pong. Upon presentation of the ER, her physical exam had temperature 102, heart rate 93, blood pressure 92/68, respiratory rate of 12, O2 sat of 98 on room air. In the ER, she was non-toxic, no murmur, clear lungs, soft belly, and her right knee was mildly swollen, no erythema or warmth. It was tender but full range of motion. Her left knee also tender but otherwise normal. At this time, Peds was consulted due to the fact that she was an adolescent and this is a teaching hospital, and because they were uncomfortable with the fact that she had eaten the magic brownie 5 weeks ago. And because they can. In standard ER fashion, she received a D5 half normal saline bolus. She got a slew of labs including a CBC, RFP, LFTs, coags, ESR, CRP, BMP, RSV, UA, urine culture, blood culture, sputum culture, chest x-ray, and CT angio of her right knee.
Excuse me, why did she get bolus with D5 half normal saline?
I don't know why, sir.
Why did she get a bolus in the first place?
Sir, based on the vital signs in the examination, she did not appear to be fluid down, but I did not manage this patient in the ED.
Did she have shoulder pain?
No, sir, she did not.
Did you check to see if she had a fever?
Yes, ma'am. I do believe that 102 is considered a fever, and...
But did you consider pan-hypopituitarism?
No, ma'am. At the time, no, we did not think about that, but that's a great suggestion. She did report chills, but no documented fever.
Does she have a rash?
Yes, ma'am. I did believe I addressed that earlier. No rash was documented.
Why was this patient admitted?
We'll touch on that in just a moment, sir. Let's just talk about the differential for knee pain.
This sounds like a couple things I know of. This could be rheumatic fever, post-strep arthritis, JIA, Lyme disease, patellofemoral syndrome, Reiter's syndrome.
Thank you, Dr. Jones. And now the reason for admission. This patient sounds stable with just a musculoskeletal complaint and fever. However, 5 minutes after the contrast was injected for her CT, which we don't understand why she got in the first place, she broke out into hives.
Attending uproar!
Oh, this is such a boring case, McKay. I don't know why they're presenting it. It's just about the ER screwing up. Come on, give us something juicy, McKay. Now, everybody, this would never happen downrange where there's no CT scan. All you need is a good physical exam and a touch of vitamin M.
Or Tylenol, especially if her kidneys don't seem to be working.
After getting Benadryl and Solumedrol, she was admitted to the hospital for observation. On further history, we found out her ping pong tournament was an outdoor one near Lyme, Connecticut. We connected the dots and sent Lyme titers on her, which were positive. So we began treating her with doxycycline.
This is a great case. Can I just have 5 minutes of your time? Just 5 minutes of your time?
Bingo!
Okay, and now we're out of time. Thank you. Next, we will have a discussion about our PI projects.
Oh.